Hi, everybody. We're just opening the meeting and going to wait a few minutes to get started. Thanks for joining us today on a bright and sunny day where I am. I hope it's good weather everywhere else, but not so good that you feel badly being at your computer, of course. Just wait one more minute and then we'll start. And we are live streaming on YouTube if anyone has any problems with their computer, and it will render there as a video right afterwards, so you can watch it later, and there will be a playlist. I'll put that information in the link in the chat. Okay, let's get started. Hi, I'm Val Wolf. I'm the Executive Director of the Hamilton Clinic for the Occupational Health Clinics for Ontario Workers. I often skip over introducing myself, so I thought I'd do it today. Thanks for joining us for the fourth in our series, our Mayday Mayday series on workplace mental health and injury prevention. And today's section is considering key issues, violence, pain, and surveys. I'm really looking forward to the discussion and to hearing about some of the new resources that are being developed, as well as John's presentation on what we need to keep in mind when we do surveys. So we're going to start with Kristy Cork from WSPS, and she's going to talk to us about the workplace violence risk assessments, new and improved tools. And she's got a couple of poll questions for us, so we'll be interested to see your answers. And I'm going to present for her.
I'm here.
And
can you hear me?
Yep. Well,
I just lost power. I am so sorry.
Oh, no worries. We just did this segue over, and it's okay. This is
okay.
Hopefully that didn't cause undue poor workplace.
It was very stressful. I'm on a hotspot on my cell phones to get internet, so I'm just hoping that there's no additional issues. But yeah, okay. Oh my gosh, my lights just came back on. Okay. Thank you, Val, for the intro and for pulling up the presentation for me. So what we're going to be talking about today is around workplace violence risk assessments and an initiative that the Prevention Works Committee took on as a project in WSPS is taking sort of a lead on, is to develop a new tool to assess the risk of workplace violence. So Val, I'll get you to just sort of scroll past the next disclaimer slide and we'll get right into things. Perfect. So the current state, so workplace violence and harassment and that work-related mental harm reduction, they continue to be a priority focus area for the Ministry of Labour, Immigration, Training and Skills Development. And we see this with various communications that come out, and certainly it's been communicated to us as system partners that that is an area of focus, that we need to have dedicated sort of project and be working towards sort of minimizing those hazards in Ontario workplaces. So there were OSHCO tools. When the legislation was first introduced and the Occupational Health and Safety Act, identified that workplace violence and harassment were key hazards in Ontario workplaces and created legislation that required Ontario workplaces to not just have a risk assessment, but to have a policy, to do training, all of those things that we know are in the Act. But that was launched back in May of 2010. So these tools now are quite dated, and we know that the way that we work, what we do, how we work has changed, and certainly the hazards around workplace violence and harassment have also changed, right? Like a lot has happened. We're working more virtually now. Our interactions have changed. COVID changed things. So there certainly is a need, and it's been identified that those tools are maybe no longer serving all of the sectors in Ontario. So we have a bit of work to do to revise, revamp those tools to make them user friendly. And we know that incidents continue to increase. This isn't a hazard that has gone by the wayside and that isn't an area of concern anymore. Maybe the next slide, Val, will sort of highlight this need a little bit more. So in 2022, there was a survey that was conducted, collaboratively with Western University, the University of Toronto, and the Canadian Labour Congress. So this is a brief summary, but certainly if anybody wants an access or a link to the exact survey and all of the details in that survey, I will put my email in the chat when I'm done presenting, and I'd be happy to share that with you. But essentially, the summary of the data spoke to over 70% of nearly the 5,000 respondents have experienced at least one incident of workplace violence or harassment in the past 2 years. Now, I don't know about you, but when I read that, I was shocked. I couldn't believe that that was the percentage, at least of this select group of individuals. And I know John's going to be talking about surveys, so maybe he has some issues with how this survey was done or the effectiveness of it. But either way, that is a very high percentage. And this is across various sectors. So this isn't just the service sector or the healthcare field or education field. This includes manufacturing, includes retail, includes many different sectors. And it identified that third party and coworkers or colleagues were the most common perpetrators. So there's a lot of interesting data that can be gathered from this survey, but the key takeaway is that this continues to be a top hazard in Ontario workplaces for workers. And the effects of workplace violence and harassment are not just the immediate sort of physical injuries that maybe we sometimes think about related to workplace violence, but certainly the psychological impacts and psychological injuries that occur when people continue to be in situations where they are aggressed upon physically, verbally, emotionally. So some other studies have indicated that across the board, there's an increase in severity and frequency. There's also this increased fear to report and fear of retaliation. So this is one thing that we really do need to look at is why are workplaces or workers not reporting this? Because I guarantee if we went and talked to workplaces in Ontario, they would not identify with this 70% because these incidents are so underreported. So if workplaces don't know about it, if people are not reporting it to their employer, then certainly how are employers supposed to recognize that this is a top hazard and what's going on and invest in resources to minimize that risk if they're not aware of that percentage or how it's impacting their workers? It also identified that there's new harasser tactics. And I think this also speaks to how work is changing, that we're now maybe in a more virtual environment. There's more cyberbullying, leaving people out of communications and things like that, because maybe we have some of that, some less to less, less and less face-to-face contact with each other and with customers. Okay, Val, next slide, please. So I have our first poll question here, and and Val noted it at the beginning, that first OSHCO tool, it should be OSHCO. I think I was getting confused with like OCAO and all of the acronyms that are involved in health and safety language. But the first poll question, and I think Tony's pulled up a Slido here for me, thank you. What tool does your workplace currently use to complete a workplace violence risk assessment? So you can select any that apply. But essentially, are you using the previous OSHCO tools? Do you have your own sort of corporate template that maybe has been passed on from, your larger organization at a corporate level? Did you create your own workplace violence risk assessment or other? Maybe there's another place that you sought out that information, or you don't know, or you have not completed a workplace violence risk assessment. Oh, sorry, the correct acronym is OSHCO. So that was that 2010 one that I mentioned a couple slides ago that was created in anticipation of the legislation coming into effect in Ontario. And that tool is still widely used. We still, provide it as a resource for customers as well. Okay, so if anybody wants to go ahead and just answer, and we'll take a look at those results. You do have to hit send at the bottom. So once you've selected on that Slido, you just have to hit send at the end, and then we can sort of see and it is anonymous, that nobody else will see. Oh, wow. So we have a pretty even split here. A lot of people have a corporate template, or you've created your own. Some people are not sure or are using another tool, and less are using those existing OSHCO tools. The good news is it looks like most people, maybe with the exception of a couple, have completed workplace violence risk assessment. So that's good. And I should mention, maybe before we move on, the reason I'm sort of selfishly asking you these questions is because we are taking on a project and we're doing some research to figure out sort of what tools people are currently using, what's working, what's not working, so that when we go into developing a new tool, we want to make it as user friendly as possible. We want it to meet the needs of Ontario workplaces. So I do have another question coming up too to try and get a little bit more information out of you, but that is what we're trying to do, and that's why I'm asking those questions. Okay, so thank you for responding to that first slide, Pool. I appreciate it. And the next slide, please. Okay, so WSPS is leading a project to create a simple, easy to use, and updated tool. So we've been in consultation. WSPS has an advisory committee that actually focuses on workplace violence and harassment, and it is represented by all different sizes of organizations and different sectors. So we are working with that advisory committee to try and understand the needs of Ontario workplaces. Um, our focus for year one really is to focus on simplicity and to view this tool through a small business lens. We need to make it easy to use. There are still a lot of businesses in Ontario, specifically small businesses, that do not have a workplace violence risk assessment. So understanding that there are some barriers for workplaces to get that work done, what's happening, maybe they're not even aware of the legislation, or that there are templates to use, or they just don't see it as a priority. But either way, the tool that we're working on really is focusing on being user friendly, being accessible. You don't have to have, a PhD in health and safety, not that that really exists, but to be able to complete this tool. So anybody should be able to pick it up, to use it, to click on it, and make a difference or assess the risk of their workplace violence and harassment hazards. Now, our timeline is that a pilot should be, our goal is to have that ready to be launched at sort of the end of fiscal in April of 2025. So we are going to do some validation. We are going to do some other work to try and, come up with a product that is, within scope and, with meeting the needs of, again, those workplaces that we're really focusing on. And then the idea is going into year two, we'll do that pilot, we'll make any adjustments as necessary, but we will launch a free tool that will be available to all Ontario workplaces. Now, I should mention, if you're wondering like what tools exist, certainly that previous OSHCO toolkit is still available. But I should also mention that there's some other ones out there, like PSHSA has done a really good job of creating some workplace violence risk assessment tools specific to healthcare. So there's a fantastic tool for healthcare if that's the industry that you're in, as well as education. And they just recently launched their education specific tool. So there are some really good tools out there, just depending on, again, some of them are sector specific. But if you need more information or you're looking for additional resources, I will again put my email address in that chat so you can reach out and I can share with you, what I know and what's available. So don't start anything from scratch. Hopefully, there is something that will meet your needs. All right, next slide. So the second poll question I have here is, I'm curious what you think. And again, maybe it's not a barrier for you at your organization, or maybe you have struggled, but thinking about Ontario workplaces, what do you think are the barriers for workplaces to effectively complete a workplace violence risk assessment? Again, we've worked with some Ministry of Labor inspectors, we've talked to different organizations, all different sectors and sizes, to try and really figure out what these barriers are and why workplace violence risk assessments, first of all, sometimes they are completed, they're done. There's a piece of paper in a binder that is a risk assessment. So when the ministry shows up, they have something to show them. But it's not really effective in minimizing those risk of hazards or helping to identify and implement controls. So what do you think are the main barriers? Is it that the tools right now aren't great? They're too complex? Maybe there's just a lack of knowledge or understanding. Maybe it's a lack of enforcement. No one's coming and knocking on your door to ask for your workplace violence risk assessment. So it's just not a priority. So if you can go ahead and just answer that question for me, again, selfishly being part of our research gathering here as we work on this. I'm going to wait for a couple more responses to come in. Or maybe there's something else that isn't an option here. You can go ahead and put that in the chat too. I'll take a look at the chat and see. Okay. All right. So let's see. Oh, okay. So thank you for everyone for responding to that. I know, it is a combination of a lot of these different things. And again, depending on the organization, the size of the organization that you work in, the resources, some people have, very robust corporate health and safety policies where it would never be an option not to do this because someone at a corporate level is coming and knocking on your door. Um, but we do want to remove these barriers. We do want to make sure that it's not just a, pencil pushing exercise where we're doing these risk assessments, once every 3 years, and then it sits and collects dust in a binder. And that's sort of what the ministry has told us as well, that they want this to be a tool that is easy to use, easy to update, because it does need to get updated, right? Work changes. Certainly every organization should have revisited their workplace violence risk assessment during COVID, right? Because the way we work changed, especially if you're dealing with customers and interacting with the public. Maybe you put in barriers like plexiglass barriers, and that needs to be updated as one of the controls or the access that people have to staff. Maybe security has changed at your organization. All of those things, right, require the workplace violence risk assessment tool to be updated. Even if you have people now in home offices, or maybe they're going out into the public, or the way the interactions with the public have changed. So again, it's really important that those risk assessments be reviewed, be updated more often than I think they currently are, just so that they stay effective. Okay, next slide, please, Val. So I did leave a bit of time, about 10 minutes here before the next person needs to jump on. I just wanted to open it up for some questions, and I guess just a bit of communication, like what are you looking for? I would love to know, what's going on with workplace violence risk assessments at your organization, what's working, what's not working. If you have any ideas, if you want to be part of sort of a pilot group, then please let us know, because this work is continuing. We're still in the research, sort of literature review phase. Um, so if there are any questions, any ideas, I'd love to hear it.
I don't see any in the chat right now, but I'm interested. It's a good reflection for me because we've used the OSHCO tools and the PSHSA tools
Mhm.
in the past, but I would actually, I'm not sheepish about saying we have not used them since probably a few years before the pandemic. So they're very physical location based. And I wondered if you, in your experience at WSPS or with some of the workplaces that you've already engaged with, have looked at like how does one do this kind of thing when each individual works in their own home and faces a myriad of situations there. Have you dealt with that at all, even internally at WSPS?
Yeah, you know what, Val, it's really interesting. And we've had a lot of questions, even from customers, around specifically the topic of domestic violence as it relates to workplace violence when people are working out of their own homes. And this generates a lot of conversation because, we're told, and we were told in the pandemic, that home is the safest place for everyone, right? It'll keep us safe from a virus through the pandemic, but it is safe and secure, and you can lock your doors and all of those things. But when someone else that might be in the home is putting someone at risk for, in a domestic violence situation, is that considered workplace violence if they have a home office? So we've reached out to the ministry around some of these questions, and certainly, every situation is unique, and the ministry does not enter people's private residence to do,
Anything?
inspections and things like
Mhm.
that. But what we were told is that that duty to accommodate still exists. So if they're aware of a situation where someone has put their hand up and said, yeah, I'm not safe at home, I am a victim of domestic violence, and they're reaching out and they're looking for a safe work plan or looking for alternatives and accommodation, that it would be expected that the employer take necessary steps that are reasonable for the safety of that worker and to allow them a safe work environment. So those are different things that have sort of come up. It's not that easy, right? It's not a cut and dry black and white situation. And again, when we work from home and when we talk about things like cyberbullying and different types of abuse that can happen virtually or on the phone, if you're a call center operator, things like that have to be considered in your workplace violence risk assessment. It's not just that sort of physical interaction with colleagues, coworkers, and customers and third parties, right? It can be so many other things now because of how we work.
Thanks. I don't
Are
know
there
if
any
anyone
other?
else on the call. Sorry, I got distracted because I just got an email that says people don't all have the link, so I'm going to paste it in the Eventbrite. But yeah, I don't know
Oh,
if anyone
okay.
else on the call has any comments on whether they've been able to post-pandemic add a work from home dimension to their workplace violence, not necessarily specifically around domestic violence, which is even more challenging and more fraught, I guess, but even in the environment and any sort of crime prevention elements
Yeah.
kind of thing in someone's work situation. I don't know if anyone on the call, and I'm just going to go over to my Google.
Yeah, I
I
mean,
paste this
unless
link.
anybody else wants to chime in, but it is an interesting topic, right? Because the current OSHCO tool does have sort of those high risk areas, right? Where we dive in a little bit deeper. Let's say someone does work in a high crime area. That is one of the questions, right? Where we have to do a bit more investigation and answer a few more questions. Or if they have remote work environments, right? One of the things, or even working alone, right? Or in isolation can
Mhm.
increase the risk. So that's something to consider, right? We know that part of your workplace violence risk assessment and the program has to identify how your workers are able to summon immediate assistance. Well, that's one thing when you're on a factory floor and there's hundreds of people around and you have sort of an emergency SOS button or on a radio, things like that. But it can be quite different when you work remotely. So some of the things that, just as a tip that our workplace has done, because we also travel quite a bit as consultants, is on our work phone. So this is my Samsung work phone. If I hit the power button 3 times, it sends an immediate SOS to who I've set up as my emergency contact. So I have my manager and my husband, and it gives them my exact GPS coordinates, and it takes a picture of the front camera and the back camera and sends to them. So that's one of the things that we've set up, recognizing that we have so many staff working remotely. We don't just have a physical head office that everybody goes to every day. So if we are ever in trouble, obviously 911 is an option, but there's other ways to get help as well. So that's just one of the tools, but we need to leverage technology, right, to make it work in this, new way of working and remote work environments.
That's brilliant. I don't know if
I
people.
see
I
Kathy's got a question here.
go ahead.
Is there still lots of training offerings on the older tool? Just wondering if people still know about the tool and the expected risk assessment required under legislation. So my understanding, Kathy, and the work I've recently done with customers in this area is there's not a lot of training on how to do a risk assessment based on the previous OSHCO tool. However, workplaces do know that risk assessments are required under legislation. But that previous tool is just one type of risk assessment and one way of doing it. The ministry doesn't say you have to use this tool, although it is still the link provided is based on that tool. So no, I wouldn't say there's a lot of training on how to complete it. In fact, we still get a lot of requests and consulting requests to go in and do risk assessments for organizations. And we're still sort of using a modified version of that tool at WSPS as well.
Do you know if iPhones have the same emergency contact possibility as the Android system does?
Yeah, so there are options setting up an iPhone, and we worked with a customer that their work phones were iPhones as well. So instead of just emergency being 911, that's still an option, and it should still be an option on both devices. But there is a way that you can set up emergency contacts on an iPhone or on an iWatch, like an Apple Watch.
Hmm.
So that's something to consider as well, right? just again looking into that technology and seeing what's available and using that as a means for workers to summon assistance, because often we have our phones in very close proximity to us wherever we're going, if we're walking in a parking lot, things like that. So again, it does just give one other option. For it doesn't prevent violence, I'm not suggesting that, but it is one other way of making sure that we can summon assistance.
Interesting. I worked with, I don't know if you've ever worked through the tool CPTED, Crime Prevention Through Environmental Design. That's when I used to work at a university. It was developed actually in Scarborough. But
Hmm.
it's another tool. It's around, like, that's all about external perpetrators or you know what I mean, people that you don't know. Whereas of course
Yeah,
harassment and a lot of workplace violence can be from people you do know or from your
yeah.
customers, I guess, or others that you encounter. But it would be great to find something to integrate all these different tools.
Yeah, and when I worked in healthcare at the hospital, certainly we use tools like that as well, because there are some workplaces that are, have very strict security, and it's like Fort Knox and hard to get in and out, and the risk of perpetrators or external individuals to the organization is not the highest risk because they
Right.
certainly are not allowed access. But there's so many workplaces that are public, right? And that's why, when you can't lock things down and things are open 24/7, that you really do look at that external, like physical environmental scan to see, are there hiding areas? Where are your bushes, trees? Are there blind spots? What does that look like? How do people access different areas? And would you know if someone was there? So absolutely, that physical inspection is just as important as considering sort of a coworker, colleague, perpetrator.
Mhm. Thanks. I think we should probably move on to the next talk, but this is
Okay.
excited to see the new tools, and it's a good
Yeah.
reminder. And I guess we haven't really talked about, but how it relates to workplace mental health. I mean, workplace violence and harassment prevention is part of the workplace mental health priority, as identified in the system for the province of Ontario, and the stress about violence and harassment is also a factor in people's health too. So fear and working in fear and that kind of thing. So we need to,
Absolutely.
yeah, we need to keep all that in mind.
Yeah.
So
Well, and
thanks
I
a lot.
think, making the connection a little bit is, people are not coping very well at the moment. There's so many different stressors that exist, not just work related, but with financial stress and different conflicts and politics and, cost of living, all of those things. So when we're already sort of living at this elevated level of stress, then when things happen in the workplace or we're in situations, we're not coping as well. And I think that's why through the pandemic, and there's lots of reasons, but that we started to see an increase in workplace violence and harassment is because people are just not able to, regulate their emotions as well. They're saying and doing things that maybe they normally wouldn't,
Yeah.
because, yeah, we're kind of living up here right now with all of those various stressors that exist in the workplace and outside of the workplace. Um, so absolutely, it's all connected.
Yeah.
And I'm sure Kathy's going to touch on that as well. I did put my email address in the chat. So if anybody is looking for additional resources, different workplace violence risk assessment templates, or just have questions, please don't hesitate to reach out. We're here to help and support.
Great. Thanks a lot, Kristy.
Okay.
And we'll definitely have you back next year to show us the pilot, and maybe
Yes,
we can
please,
engage
please do.
our audience. And hopefully they all get the link next year. So, because we did have 60 people signed up today. So I don't know, obviously something went
Okay.
flawed. I have been traveling quite a bit since setting up this event and hosting it. In fact, I've barely been at my own desk to host it. So I'm sorry if I missed something in the process. But thanks again, Kristy. I'll be here for a
All
little
right.
while, but I know you have to go.
Yes,
So yeah,
absolutely. I'm going to hang out.
okay.
Perfect. Thanks, Val.
Yeah, indeed. Thanks. And Kathy,
Okay.
welcoming you from Infrastructure Health and Safety Association, not a stranger to our audience. You've presented, I think, the past 2 years at least, and you're doing such important things about opioid harm reduction at IHSA, and I'm very interested in this topic around pain management. Of course, we're very interested in injury prevention before there's even pain, from an ergonomics or health safety perspective, but also in the the secondary prevention elements of pain management, I think, are really critical to understanding the opioid crisis and to hopefully trying to make a difference. So thanks very much for joining us. Looking forward to your talk.
Well, thanks so much for having me. And yeah, we've been doing lots is for sure around workplace mental health, and we've been looking a lot at IHSA right now, like as you mentioned, around opioids and opioid related harms, and that is largely due to we've taken on a project with the Ministry of Labor to look at specifically opioids in the trades and some of the problematic use that we see within the trades, and kind of get upstream. You know, naloxone in the workplace, great thing to have, but you know, that is very much you know, a tertiary kind of like downstream measure. We want to get up into the prevention side of things. So I'm here today just to give you a quick highlight on some of the things that we are talking about within that larger project. And one of the really important pieces is looking at pain. And so there's you know, really this trifecta, if you will. This deadly trifecta that we're seeing in the trades and other sectors, really. And I'm hoping that today this will help you to see that alignment, that, you know, pain, drugs, and our workplace culture, in particular on the job site, they all kind of come together to be this trifecta leading to hazards in the workplace and to workers, and to increase, you know, we want to increase, you know, everyone's awareness of some of these issues, but more importantly, I want to give tools and resources out to those who are trying to manage some of these risks so that you know what's out there and what's available. So good pain management supports in the workplace help workers really to manage their situations, not just to function at work, but also to avoid the all too common trap that we're seeing of, you know, moving towards the illicit drug market to be able to secure opioids so that they can cope with their pain. So, you know, learning how opioids, chronic pain, pain management intersect when addressing opioid related harms and workplace accommodations is really important. So that's why, like I said, we are working really hard to look at this issue. So let me just jump right in here. I'll move to the next slide. So, you know, for some people, they think, okay, we talk about pain, but really what we're talking about in this, in the relationship to opioids is really about chronic pain or persistent pain. And I'll just give you the definition here. So chronic pain really is that persistent pain is determined when pain happens to last longer than 3 months. So sometimes chronic pain can occur, you know, without a known cause, right? Sometimes you just have something that's going on. You're not really sure what that pain's coming from. It may come from an injury that has either healed, maybe healed incorrectly, or still trying to be healed, or it could be related to a condition that's being treated. Now, I'm not sure if you know, when I started doing the research on pain, I didn't realize this. So did you know that the World Health Organization does now recognize pain as a disease and not just a symptom of something else? So this is really important, I think, for workplaces to understand, and I'll get into that in a moment. But first, I think it's good if we all have a better understanding, though, of the prevalence of pain and why we should even be talking about this topic today. And beyond really the link between opioids and pain, but just more important, just more broadly, I think, around chronic pain. So, you know, when we talk about the prevalence, you may or may not know, but 8 million people in Canada live with chronic pain. And it's a condition, you know, that affects both, as I'm sure you can imagine, both your physical and your mental health. And it often inhibits your ability to work, play, and certainly your relationships and overall your quality of life. And studies are suggesting that up to 40% of North American workers experience chronic pain. So this is, you know, when we talk about the 8 million, it's not just, you know, the elderly or people who are out of the workplace. We have 40% in the workplace that are experiencing chronic pain. And of course, this I found really interesting, that this stat, the 40%, exceeds the number of people living with cancer, diabetes, and heart disease combined. So is it a workplace issue? Well, I would hope that we start to think of it as a workplace issue, managing chronic pain. And of course, we also know that pain, and this is why IHSA is taking a look at this, pain really does disproportionately impact workers in the trade. And, you know, and I think you can probably imagine why. I mean, that's physically demanding work, right? Okay, so when we're talking about chronic pain, it is very complex and it's very varied in nature. And it's often linked to many different conditions that we're familiar with, like, of course, headaches, arthritis and cancer, perhaps nerve pain, back pain, and my personal favorite, fibromyalgia. Now, chronic pain can also be an unstable condition. You know, it's not always something, you know, that's going to be happening every day. But we also know that chronic pain can at times be very debilitating for a person. Now, if you suffer from migraines, you're likely familiar with that debilitating pain. Someone with fibromyalgia, it's definitely episodic and it can be quite debilitating as well, among many other conditions that people are working with today. Now, chronic pain in work. So experiencing chronic pain at work, as you can imagine, can be problematic on many fronts. It's associated with increased absence, job performance, decrease in your job performance, your concentration problems, certainly. And of course, physical limits and for some displays of impatience towards coworkers and customers. And as we are linking, and we know, problematic substance use as well. Now, chronic pain can be very invisible, right? It's not something you necessarily see happening with a worker. And workers will often go to great lengths to conceal it as well. Oops, sorry. Therefore, pain can be, you know, like it can be really hard to spot in the workplace. And it makes it hard to offer support individually to those most in need. So we're going to talk about why we need to bring this out as more of a broader workplace conversation and not simply at the individual level. Now, musculoskeletal disorders. Val, hopefully you'll be happy to see this slide. There is definitely a link in the workplace with pain and musculoskeletal disorders. So according to WSIB, musculoskeletal disorders represented over 40% of all lost time compensation claims in Ontario. And we know, of course, that when left unaddressed, musculoskeletal disorders also threaten both worker health and the safety in the workplace, as well as business economic performance. And about 34% of construction workers have had at least one musculoskeletal disorder symptom. So they're displaying at least one. So this is one of the reasons why I just say it really looks at musculoskeletal disorders quite a bit, because that's a pretty high significant number. But what I think is really important, and what I'm trying to drive home with my work with the opioids, is that compared to those without musculoskeletal disorders, the prescription opioid use has or does triple among construction workers with musculoskeletal disorders. So we know that that's where a lot of the opioid use and the prescriptions are coming from. So when we look at the recent stats around opioid use among construction workers, you know, like I said, you can start to make some of the connections between the musculoskeletal disorders, chronic pain, and the opioids. And, you know, there's certainly several other influencing factors that uptake, you know, the uptake of opioids in many industries. Folks definitely, you know, it's not limited to just the trades. So if you have a workplace where there is a lot of people doing heavy physical labor, your workers are definitely at higher risk, according to the Institute of Work and Health. So from some of the research we're seeing, the more recent research out of the Institute of Work and Health around the opioids, they're starting to link that, yes, definitely if you do heavy work, you're at higher risk of opioids. And that shouldn't be of great surprise to most people, but it is validated now through the research. So we can thank the Institute of Work and Health for that. So often, you know, we know that often workplaces can be the source of our chronic pain, right? From the work that we do. All right, so I often get this in the construction industry or the trade industries too, saying, well, we don't have drugs on site. Well, I don't know. Do you not? I don't know. But I would say, yep, you probably do. And I would say, you know, especially not necessarily just the trades, but, you know, manufacturing and you know, certainly mining and other industries that, you know, have that physical component, a high demand on the body, there is likely drugs circulating through the workplace. So what can you do? Like I said, you know, I think it's really important that we consider safety on our, you know, certainly on our construction sites and in other industries, in the same way that we think of other safety sensitive workplace issues. Yet there are other reasons to be concerned if drugs are being used by workers, whether, you know, the use is due to chronic pain issues or mental health or addiction challenges, or even short-term acute pain management. Drugs such as opioids, you know, are a concern, along, of course, the illicit street drugs like fentanyl and non-opioid street drugs like cocaine, crystal meth, among others. Sorry, I just got a note that my internet's choppy, so hopefully you can hear me okay. So there are opioid-related harms that can result from using opioids, especially for chronic pain management, and this is where I think using opioids is problematic. Thanks, Val, for stopping my video there. So opioid-related harms, in case you're not aware of, opioid-related harms are it's a basket term for several things. And really, when we talk about opioid related harms, we're talking about opioid use disorder. We're talking about toxic drug poisonings and adverse effects from a drug. If you've been given a prescription, you may be using it as prescribed, but still have an adverse effect. And of course, what we hear often in the media is overdose deaths or toxic poisonings. And, you know, I'm not going to spend a lot of time, you know, obviously today talking about drug addiction and that aspect here in the workplace, because I really want to shift the conversation a little bit more to about talking about pain management, because we know pain management often involves drugs. And this really should be monitored closely by a physician. But what can we as workplaces do? However, like I said, it's to, you know, focus on safety first, right? That's got to be our mandate. So what does that all look like? Safety first. Well, there's a couple of things we can do. We can ensure we're managing impairment concerns effectively. So if you haven't checked out the newer guide from the Canadian Standard Association, it's Z1008. If you need guidance, I encourage you to check that out. It is a guidance document on managing impairment in the workplace, and they do have a guidance document specifically around managing substances in the workplace. Of course, you know, getting upstream, right? Preventing those musculoskeletal disorders and preventing accidents, injury is really important. Of course, as well as fostering employee well-being, because we know that experiencing chronic pain, you know, it may not be work-related. You might be experiencing chronic pain in the workplace. Having good coping skills to be able to manage that effectively is really important. So helping employees to also develop some coping skills is really a good thing to do as well. So there's a couple of things we can do here. So like I said, we can pay careful attention to the working conditions and identify, of course, and eliminate those potential hazards that could be causing chronic pain, or we can certainly try to prevent chronic pain for many workers by doing that. And then we need to practice, obviously, the safe ergonomics as mentioned, and help structure the work environment to minimize that chronic strain on the body where possible. And I hope workplaces are doing this, but, you know, I think it's one of those things we tend to minimize sometimes and forget about is the ergonomics. So I encourage you today, you know, that if you have a chance to think about even your own personal ergonomics and how that affects you, and if you're in chronic pain, to really try to manage that, and definitely advocate for yourself if you're finding yourself in pain due to the work that you're doing. And of course, I mentioned Z1008. All right, so employers, you do have a duty to support. You know, workplaces can support those living with chronic pain, just as they can support individuals living with other chronic illnesses like diabetes or cancer. because chronic pain is considered a disease, as I mentioned earlier, and can be disabling, it should be managed by the disability management system. And we know, of course, disabilities are protected ground under the Human Rights Act of Ontario. And supporting workers as they manage their pain at work is not only, a legal obligation, it really is also the compassionate response to those in need of accommodation and support in the workplace. So I hope you consider your duty as employers as well in this issue. Now, the first slide, the title page was around culture, and the culture being a piece of all of this. And we must all challenge our personal attitudes and belief around chronic pain, and some of the barriers that are created in the workplace because of that. If you think back and reflect back to years ago, fibromyalgia is a great example. Fibromyalgia was considered, all in your head. It's a mental health condition. It had nothing to do with, you're really not feeling pain. It's all up here. Well, we know a lot more about fibromyalgia. It is a bona fide condition. It can be diagnosed like any other condition. And, someone is in chronic pain and it's episodic. So we can help that person manage. And I won't continue more on that thought. But we do also know that often feel reluctant to talk about their pain due to fear of discrimination, and sometimes job loss even. In the trades, we know if you can't work or you're struggling to do your job effectively due to pain, sometimes you're just not called onto the job, especially if you work in a unionized environment where you go from job site to job site. If they know you can't do the work as well as the next guy, sometimes you just don't get called back. So people are reluctant to step up. And that's where the switch to the opioids often comes in play, is because people are just trying to cope. So taking the opioids so that they can get back to work and they can keep up with, the younger guys or the guys that aren't injured, or women, it's problematic, right? So we want people to be able to step up and talk about this. And remember that, like I said, chronic pain is a disease, and it does require a compassionate response from workplaces. Now, that being said, we still know that many people still believe in the suck it up approach to managing pain. In the trades, this is still quite prevalent. A lot of, and I'll say men because it's often tied to some of the masculine norms that we have in society, but men have to be tough and, suck it up at all costs, just kind of get back to work through the pain. And this does turn to a lot of self-treatment, including self-medication, which can be problematic and unsafe for both the worker and the workplace, that you can imagine if people are self-medicating themselves. So I found this study really interesting. There's a 2021 Harvard Business Review study that showed that leaders have limited awareness and knowledge about how to lead those with chronic pain. And there's some interesting stats that came out of the study. 80% of leaders recognized that chronic pain was a concern for their workers. So a lot, although it's in an invisible condition, most people, I guess leaders are saying, yeah, we know it's there. We know it's a problem for our workers, which is great. And 80% of leaders do not know, though, how to deal with workers in pain. So they know there's a problem. They know it's there, but they're just not sure what to do. And 77% of leaders want to know what they can do to help. So this is important. Workers themselves, however, may feel reluctant, like I said, to speak up. So we have to look at what are those barriers on folks speaking up and working with their employer on managing pain. So what can be done to help? Here's a couple things that I think workplaces can do right now to start tackling this issue. I think first, we need to listen to the worker and work towards finding solutions for managing chronic pain, especially for those who do come forward and who do want to work with the employer. So those quick wins, right? Those low-hanging fruit, if you will. And then we need to help all workers understand the need for safe, informed chronic pain management. We often, like I said, can be exposed to pain or chronic pain for multiple reasons, not always workplace related. So just having conversations around pain and how to manage chronic pain is really an important thing that we can all do at the broader workplace level. Sort of normalize the conversation. Hopefully that will help remove some of the barriers. So education and, educate and raise that awareness. In particular around potential harms around taking opioids for chronic pain or even short-term pain, is really important as well as part of that conversation. And, if you can increase access to chronic pain management resources, so through that education, making sure there's links and resources provided where there's some good credible resources. I think this is really important piece of building your chronic pain management program for employers and supervisors. So, educate your workers around pain management, but also educate your supervisors, right, on how to support, how to have those supportive conversations. Of course, encourage workers to seek individualized pain management treatment plans with a knowledgeable primary care provider, and hopefully one that in particular that knows a bit about pain management and chronic pain management. Be ready to be ready in case an opioid related emergency occurs. So have naloxone on every work site. If you don't, we don't know when someone will be needing it. We never know when someone might have an adverse effect. Having naloxone on site is not just about those with opioid use disorders or, people using illicit street drugs. Naloxone can be a tool in which to support someone who's had an adverse response to a prescribed opioid, who they may be taking it as prescribed but are having an allergic reaction. So it might be something that you're just not aware. We know more and more stats are coming out that seniors are having problems with opioids, and so we need to, I personally, this is my personal thought, I think naloxone should be in every home and in every workplace, every home that someone takes opioids. I should state that. And of course, demonstrate compassion. It could be you next, right? We just never know when we'll be in chronic pain or that next person have chronic pain. Now, just in reflecting around Narcan, we know that there has been a newer regulations, a year now, that workplaces, if they're at high risk, should have naloxone on site. And I know that the Ministry of Labor's program that they had has been winding down, and we've been getting calls at IHSA wondering on where we can get Narcan. And so this is a place where you can go ahead and order Narcan as a workplace and purchase as many kits as you need. But just remember, this is a downstream approach, but an important thing to have in your first aid program. So, what is IHSA up to these days is, as I mentioned, this talk around pain is really coming out of that Chief Prevention Project with the Ministry of Labor. And part of what we're doing is developing out a safety talk series attached to the project. And we're going to be looking at several different topics, but one of the topics that we're taking a closer look at is pain. So there is this little mini pain management series that will be available, and I'll post it on our website by the end of this month. So I encourage you to come back and look for those. Those just a quick screenshot of what's to come. They're in with marketing right now, going through their final edits. But in the meantime, got lots of resources here that I'll make sure are out to you all that have attended today and post it with OCAL. But we developed a guide, a seed document with the Opioid Project around all things related to managing opioids in the workplace. And we pulled together lots of different resources, and some of the resources were around pain, because that certainly, like I said, is a piece of the larger puzzle. And these are some of the resources here that, again, are hyperlinked to make sure are left to you. But if you don't know much about managing chronic pain, or it's not something you've ever really thought that the workplace should be doing, or you might want to explore a little more. Some of like Pain Canada is a great resource, and there's some great research documents also listed here in the resources. So I'm just going to wrap up here. If you have any questions or comments, I'm free to talk now about those, or I will stay online until later. But I just want to thank OCAL again for having me back for another year. They don't seem to be getting sick of me yet, so that's a good thing. There is a QR code here that you can scan if you'd like to just get access to some of the resources that are available right now on the opioid related project and other mental health resources that we have. But otherwise, thank you. There's my contact information. And I'm going to just stop share here so that we can see everybody.
Great. Thanks a lot, Kathy. Once again, very, very informative, and a lot of valuable links and a lot of great resources. I know they're targeted to construction, but I think they probably can be used in other workplaces fairly easily.
Yeah, definitely. There's a lot there, but it's not just a construction issue. Like I said, if you have a workforce that's doing a lot of heavy work, there will be problematic opioid use happening in the workplace. So definitely can use those tools. But I think it's important. We all, different times you have surgery, right? You get prescribed an opioid, you have an injury for whatever reason, you slipped on the ice, or you went golfing and you threw out your back. You might be on short-term opioids, and problems can occur even with short-term opioid use. And I think we need to reflect on that as well. So especially in the downstream approaches, like in having naloxone at a minimum.
Yeah. Well, I think even being conscious of that in disability management situation, I think of the risk and supporting workers in when they're injured, that's secondary prevention, right? And in return to work, not having the expectation that you can recover instantly and still lift and still push and still pull and that kind of thing, because I guess
just
go ahead.
Absolutely, Val. Yeah, no, I was going to say, just because WSAB might say you're ready to go back to work doesn't mean you are ready to go back to work. Because, we have guidelines with all of the insurance companies. They have guidelines, treatment guidelines. And sometimes people don't fit within the guidelines. And, their body might be slower to recover. And I think, but there's, especially in the trades, there is a real impetus to get people back to work early. They work hourly, right?
Yeah,
and so they want to get back to work, right? Got to get those bills. Yeah, they got to get those bills paid, and there's labor shortages. So lots of reasons why someone may turn to using an opioid or using any strong pain medication. And I think we need to be, more sympathetic and aware and have those conversations.
I see Miri has posted a comment about the important to consider the impact of chronic pain. Ooh, I scrolled away from the comment, Miri. I don't know if you want to make it yourself, because you also included a link to, I think, is it a provincial website about chronic pain management, which I'd be interested in knowing more about. But the comment is that the impact the pain itself has an impact on mental health and illness, which can complicate and extend recovery for sure. And also mental illness can have a physical pain response, right? They are tied together.
Absolutely.
Yeah. So Amiri, I don't know if you wanted to unmute and add anything about the website and your use of it yourself, or if you know any more about that, take control, take charge, or do you know anything, Kathy?
So when I did some research on this, there's so many great resources out there. And if there's any very specific ones to the workplace, I apologize. It was a while ago that I did some of this research, so I would definitely check out the links that I did provide there. There's some great tools and resources, and what I tried to do is like some of those pain portals, right? That they'll give you the links to a lot of other resources. So go in, check them out if this is an area that you yourself, maybe yourself have chronic pain, or someone with chronic pain, or you are in charge of that element of the disability management at the workplace. But I encourage occupational health and safety folks to really think about pain, right? To think about it, it's not just you need to partner with disability management, maybe at the individual level, but we need to start talking about it from a health and safety prevention piece, because we want to prevent further harm. So we want to prevent some of those opioid related harms, of course. But to do that, we need to manage pain effectively in the workplace, and we need to have conversations around it. And we also obviously need to prevent injury. But we know pain, as I keep stating, isn't just about workplace injuries. Pain comes from a myriad of reasons, right? Like just so many things, right? Mental health being one of them, of course.
Thanks. Thanks you, Kathy, and Miri. I see she's having mic issues, I think, so can't speak. Lori's asked about pain management courses available for free. I don't know if that's not, does anyone know? Anyone else here? Are you, Kathy, for sure?
You know what, if there's any specific questions around resources, I don't mind doing a little digging for people if they want to drop their information, or maybe I can drop my contact information into the chat now. Folks can send me a direct email, because yes, there's lots out there. I know as part of BC's Tailgate Toolbox program, when you take their training, they actually have a guest speaker from one of the pain institutes in BC come and speak on pain. It's highly linked to the opioid crisis. So I know like there's people that will come out and speak and do education. Is there online management? It'll be targeted at the individual level, I think, if there is, not necessarily with that workplace lens, but there might be. I'd love to dig.
Great, thanks. Well, if you put your contact information,
I will.
We'll write you directly.
Definitely.
Also interesting to share the information too. So as I mentioned in the chat, we will post your slides. We'll post everybody's slides, and the videos will get divided into a playlist so people can share the talks as well. So now we'll switch over to our last session, and welcome to those who unfortunately were delayed in arriving, because it looks like our follow-up reminder email didn't have the link pasted into it. So I apologize for that. And we've tried to email everybody and invite them on their calendar invite in a scramble here. So the previous sessions will render right away. The video will on YouTube will render as a video immediately afterwards, so you'll be able to catch the first session if you want to. And now we'll switch to John Audick, who is the occupational hygienist in Hamilton, and no stranger to the Mayday Mayday audience, since he's been a pioneer in workplace mental health on behalf of OCAL and mostly on behalf of workers. And part of that work has included investigating survey and then becoming quite expert at the validation of those surveys, so that we can be sure that that what we're interpreting as the answer is really the answer. So over to you, John, on your presentation. Thanks.
Okay, thanks, Val. Yeah, we asked the question, how important is it to use a valid questionnaire to measure workplace stress? Like, there are a lot of surveys out there in the workplace: engagement, job satisfaction, culture, burnout, work-life balance, things like that. But very few of these commercially available surveys have published their evidence regarding validity and reliability. And there are also disagreements about whether we need to or not. Some saying that this is overkill, but what does it mean to have a valid questionnaire? There are, as an example of some of the multitude of survey services, Gallup, you've heard of the Gallup polls. They This organization also makes employee engagement, retention, and attraction, well-being, hybrid work, leadership and management, and organizational culture surveys. Qualtrics, which is often used by universities and academics to collect data, have a variety of surveys available: onboarding, work anniversary, employee engagement, role change, employee pulse, post-parental leave, employer exit. SurveyMonkey also has its online surveys, and Facebook or Meta is also getting into the game. Wherever there's money, there are people who are willing to provide you surveys. Now, surveys have been used in the EU for many years to evaluate the psychosocial conditions, and there are laws requiring you to evaluate the psychosocial conditions, also in many countries in South America. Even in the US, there's a regulation requiring the federal government to survey its people, and these things are, the results of these surveys are available online. For the 2023 survey, there were over 500,000 respondents, and that data is available online for data geeks like me. In Canada, Ontario, we have the voluntary CSA standard set 1003, psychological health and safety in the workplace. And it has 13 psychosocial factors that they suggest need to be assessed. And two of the questions we often get asked is, does your survey measure the CSA 13 factors, and is it a validated survey? And so on the first question, what we've done is we've mapped the 13 factors against the COPSUC 18 or 23, depending on how you count. And you'll notice that the ones highlighted in yellow are not included in the 13 factors, so it goes over and above. However, mapping items to scales is actually quite difficult. And Tony, if you would like to put in the first, yeah, there it is, scale. I'd ask the participants here, where would you fit this question? I feel my job is secure in these 13 factors. So if you'll take some time and select which factor you think I feel secure at my job fits into, I appreciate it. You need to hit submit in order to okay, I see some people are picking organizational culture, psychological protection, psychological support, clear leadership. Okay, we'll close it out. Thank you, Tony. Now, the second question is, I have sufficient time to complete my work. Which one do you think this should fit into it? We have the question up again. If you could select which factor. Here, most people are picking workload management, but there are still some that are picking other factors. Okay, we'll wrap that one up. Thanks, Tony. I had a couple others, but for the sake of time, I won't ask Tony to repeat that. But here are the 7 items, 7 questions that belong to the Guarding Minds at Work workload management psychological factor. And you can see that from the difference of opinion on which this one fits into, it's not that easy to map these things onto the scales that they belong to. And so this is what the work on validation and reliability tries to do, is to make sure that we know what we are measuring. So there are different ways to assess questionnaire validity. One is face value or face validity. When a person reads the survey, do they agree that this covers what the survey is supposed to cover? And then there's content validity. Face validity is for the users, and content validity is for the experts who set up the survey. Do they agree that it covers what it's supposed to cover? Then there's criterion validity. Can you compare it to a gold standard, if there is one? And it's difficult with stress, is what is the gold standard? Then there is construct validity. Do the scales function the way the theory predicts they do? And that can be convergent, that it correlates with measures that it should correlate with, and discriminant, that it does not correlate with measures that it shouldn't correlate with, and predictive. Can you predict who falls into which category based on the range of scores? So face validity, when we set up the stress assess based on the Copenhagen Psychosocial Questionnaire, we ran it past a number of worker representatives and did some pilot administrations. And basically people said, yes, it covers it. But during the pilot, they actually said there's some items missing that you don't have in there. We also heard that it was just educational to do the survey itself. And there's always an issue about striking a balance between survey being too long or not fully completely covering the topic that you're asking about. So here are the scales that come with the COPSUC survey. There's work demands, work organization, work relationships, workplace values, employment and job factors, offensive behaviors. These are some of the things that people told us that were missing. Things like shift work with job demands, measures of employment precarity, some other factors, the number of hours you work per week, health and safety conditions in the workplace, the culture in the workplace, demographic issues, obviously. We also added some there's a long version of the COPSUC questionnaire, and we took some health and symptom questions, and we created some new offensive behaviors that people were concerned about, like discrimination. The content validity, the experts, if you pick a survey that already exists, like the Copenhagen Psychosocial Questionnaire, there's an organization that developed it. And so the content validity has been kind of done by them. And they have a nice website where you can take a lot of this from. Also, the survey tried to cover as many theories of workplace stress as possible. And the CSA standard also mentions a number of theories: job demands, effort and reward, job control and influence, fairness and support. And these reflect from theories that have been put forward: the effort reward imbalance theory, the job demand control model, which was later on supplemented with job control and support, the justice model, and the most recent, which is the job demands and resources model. Now, when you pick a survey, you are picking a theory that goes underneath it, and that will shape the possible solutions. For instance, if you pick up the job demand control survey, you're not going to necessarily pick up some of the justice issues, and vice versa. So there are different perspectives on how to approach and measure workplace stress. One is the psychological approach, which focuses on the individual and it just looks at what's going on between your ears, and sometimes it's called responsibilization because it places all the responsibility on the individual. The other is the psychosocial, which looks at the interaction between the environment the person is working on. And so there are both individual and collective responsibilities. Now we have items and scales. Items are questions and scales are groups of questions. And here's an example of the COPSA quantitative demands. How often do you not have time to complete all your work tasks, and do you get behind in your work? And then there are various options that you can provide to these questions. Often strongly agree, neutral, disagree, strongly disagree is used. However, this one is actually frowned upon because something like a frequency is cognitively a little more close to what you're trying to measure than whether you agree or not that you have time. Here's another question. In general, would you say your health is poor, fair, good, very good, or excellent? That's generally called health in general or self-rated health. And here are some results. And it's a deceivingly simple question, which you think may not measure much, but in the literature, it's been noticed that this question correlates not only with mortality, but morbidity, which is amazing in itself. And there are psychologists who are trying to tease out why that question is so good and yet so simple. Now, interpreting the scales, once you've assigned values to the response options, you have to interpret them. So in this case, if you can have a fixed or absolute values, if you have 5 questions per scale and 4 response options, then the possible scores range from 5 to 50 or 5 to 20, the higher score being better and the lower score being worse, and then they're interpreted in this way. Now, you could also have relative values where the scales of different lengths and varying response options, if you convert them to 0 to 100, and some scales could be positive, some negative, and you compare them to the population average. So each scale has its own different benchmark, and then you define what's a meaningful difference from the average. And usually it's somewhere between around a half a standard deviation or sometimes less if it's a very good scale. Now, here are some results from the Guarding Minds at Work scale in the 4 categories: serious concern, significant concern, minimal concern, and strength. And if we look at the list, we see that balance is one of the most serious concerns, followed by psychological and social support. The strengths are civility and respect, and recognition and reward. Those are the 2 strongest. Now, this is assuming that it's a fixed scale, that all are measured the same scale. Now, if we took the same results and put them against the population average, we get a different picture. We still see balance as one of the factors on the negative side, but psychological and social support is actually no different than the average. Civility and respect are better, much better than the Canadian average, but recognition and reward are no different than the Canadian average. It really missed the serious problem in engagement and the other strength in organizational culture. So different ways of scoring have different implications on how you diagnose what's an issue in the workplace. Then how well do each of the questions and the scales perform? Well, if you have a scale from 0 to 100, the average should not be less than 20 or greater than 80, because that's a skewed score. Ideally, it should be 50 in the middle. The percentage missing, if you have more than 2% missing, then you should look at the question and see what could be wrong. We have ceiling and floor effects. If more than 15% are either at one end or the other end of the scale, that suggests a skewed scale. And if any one single response option is endorsed more than 40% of the time, that is worth looking at. And then there's a measure of internal consistency, which is a reliability value. It's either Cronbach's alpha or Spearman-Brown statistics if you only have 2 items. And it should be greater than somewhere between 0.6 and 0.7. And in a correlation matrix, none of the correlations should be greater than 0.7. Now, if you didn't get all that, I'll show you some examples. Okay, here are the COPSUX scales that we use, and here are the mean scores. You'll see that all the mean scores are above 20 or below 80. And so they're somewhere in the middle, but some, like job insecurity, are quite low. And others, like colleague support, are quite high. The Cronbach's alpha, we have a couple on the English version that are a problem. It's interesting that quantitative demands in the English version has lower reliability than in the French. And we have the opposite for some of the other ones. Then we have missing. Meaning of work, for some reason, meaning of work, both in the English and the French, is above 2%. Recognition also, leadership and social support, that might be because some people who fill out the survey may not have a supervisor because they are the boss in the place. And then ceiling effects and floor effects. On the bottom, job insecurity. In Canada, we have less job insecurity than in other nations. So in other nations, this one would be much lower. On the top end, we have meaning of work, role clarity, social support from the supervisor and colleagues, and job satisfaction, which are all positive scales. So it's nice to be high, but the scale is somewhat skewed. Now here's a perfectly balanced scale. You have a bell curve with the average being 50 right in the middle. And here are some skewed ones. Meaning of work, the average score is very high, 77. Job insecurity is very low, 26. The comforting thing is that these are good things. Then we look at each of the options for every questions and highlight the ones that are over 40%. So here, work fast, the middle option was endorsed, clear objectives and know what's expected, the second highest one. And here we have a few more. And let's take a look at pleased with your job satisfaction, 47% were on the 4th option. And if you look at the 4th option is satisfied, so 54%. So even though this is skewed, it still tells you something that's reasonable. Now, how are the scales correlated with each other? So with correlation, we look at 2 factors and see if they change together or not. And here, a perfect correlation is a correlation of 1. And you can see they're all in the line together. A strong correlation is 0.9. It's almost a straight line. 0.5, it's getting a little weaker. And this is no correlation at all. You can't draw a line through that. But it can also be negative, the same thing. So here we have a correlation table. And we looked at work pace and quantitative demands before. And the correlation is definitely less than 0.7, so that's okay. There is some correlation. However, when we look at quality of leadership and social support from the supervisor, we see a strong correlation. And when we look at trust of management and justice and respect, we see a strong correlation. So let's take a look at these questions and see why they're correlated. Well, quality of leadership and social support are probably related in many people's minds, and we should maybe ask whether we should combine the questions of these 2 scales into a single scale. Vertical trust and justice and respect were also close together, and we actually call this combination social capital. So it's already recognized as a single entity, and so there's probably good reason to combine these into a single scale and call it social capital. Internal consistency is how well the questions within a scale hang together. And it's rated in variety. And this is an evaluation of a recent survey that I did. And you'll notice here that influence did not pass the internal consistency or reliability tests. And when we looked at it, we found out that this workplace had a lot of decision latitude. They had a lot of influence in how they did the work, but they didn't have any influence in how much work. And so that tells us something that's unique to this workplace. And that's why looking at whether these scales work or not in reality is important. Here's another scale, PHQ-4, which examines depression and anxiety. So we had these scales that in our pandemic surveys, and we've incorporated them now into our general survey. You can see there's a lot of overlap between the two. And when we did the reliability, they were reliable each way. And so we can use these scales separately or together as a single scale. Then we have test retest. If you give the same question to a person 2 weeks after they've originally filled it out, how close will their results be given that nothing has changed in the workplace? A perfect reliability is exactly the same score. Here's some results from the PHQ-4, and you'll see that the correlation is about 0.73. And when we do the test retest using the intra-class correlation coefficient, we get almost the same number. So it's not always the same, but in this case it was. However, when we looked at these test retest, we found that for English, it worked well, 0.74. However, the French version did not. And so that's something to explore why in the French surveys, it didn't work as well. Then we have predicted, convergent, and discriminant validity. What this means is burnout, we see are related to quantitative demands, work-pace, emotional demands, insecurity over employment, and organizational justice. And we want this to be different than engagement. And when we look at engagement, we see we have different items, influence at work, meaning at work, predictability, recognition. Organizational justice is common to both of them. But essentially, they're measuring different things. We don't want everything to measure the same thing. And here's an example. We looked at people who do not work any extra hours and broke it down whether they're in management or not management. We see their quantitative demands are relatively the same. A meaningful difference is a difference of at least 5 or more. And when we looked at people who work 6 or more extra hours without getting paid, we see very much the same thing. A very similar experience, however, very much different than no extra hours. With work pace, we saw quite a difference between management and non-management, almost 10 points lower for non-management. And we also see a significant difference between management and not management. So putting in extra hours without pay for management is not as serious for work pace as it is for related to work pace as it is for those who are not in management. Emotional demands were the same. And here we see that for managers working 6 hours or more without pay, their emotional demand score was 52, whereas for those who were not management was 67. And part of this is working extra hours in management means something different than it does working extra hours if you're not in management. And we're actually writing a paper right now, and we call this one at the end wage theft. There are a number of English language surveys, and I'll go through them. I'll start with the last one there, the US, and I'll show you which ones have validation studies. Healthy Work Campaign, it has an article that's been published that shows the evidence for validation. People at Work is an Australian version, and they took a different approach. They said, we're going to use scales that have already been shown to be valid, and we'll hope that they're valid also in our context. In the UK, they put together a short 35-item 7-factor, and they did factor analysis, confirmatory factor analysis to show that they were valid for the UK. And Ireland also uses them along with the PHQ-4. And then we have our stress assess, and we work together with Peter Smith from the IWH and did a variety of evaluations, and this was published in 2019. And we also work together with the International Network for people who use the Copenhagen Social Questionnaire. Now, Guarding Minds at Work has a new version come out in 2023, and it measures the 13 CSA factors, but it also measures the new 21 ISO factors. And it has the inclusion indicator and a stress and trauma indicator. And if you add these up, you get 150 items. However, they do this with only 65 questions. And if you're wondering how they do that, they define something as an index, which is to be understood as creating culture, not reflecting culture. And so it's a different approach to validation. And here's an example of the questions, how you have 150 items done in 64. And there's one question, I am able to do my job in a way that aligns with my values. That's in each one of these 4 measures: psychological competencies, job demands, workplace inclusion index, and the stress and trauma index. And so when we compare workload scales, we have here the quantitative demands is 2 questions, work pace is 2 questions, and emotional demand is 3 questions. In Guarding Minds at Work, workload management is 7 questions. Stress and trauma has 3 of these questions in its indicator. Works hours and schedule, which is an ISO, has 2 of these. These 2 questions are in the workload and pace, and these 2 questions are in the job security and precarious work. So if you pick any one of these questions, you could be measuring more than one thing. In the past, Guarding Minds at Work suggested that each item, each question be considered within the context of its factor. However, they have revised this, and now they say you should look at each question by itself. So we have 65 questions, we have 13 factors from the CSA, 21 ISO factors, and 2 indicators, which means you have 101 different outcomes to consider, which becomes quite overwhelming. So what is survey validity and why does it matter? WorkTango is one of the websites that addresses this question in a positive way, saying it depends on you need to depend on these surveys. However, the naysayers say that why do you really need it? You don't really need a survey of validation to understand how your people are feeling. However, if you look at this statement closely, you don't really need a survey at all to understand how your people are feeling if you're in touch with them. So summing it all up, you don't really need an evidence-based survey to assess psychosocial conditions. You don't really need a survey at all for that matter. However, a survey for which there's evidence that it performs reliably and validly in a population similar to yours allows you to know what you are measuring and that that measurement is stable, it's repeatable. A workplace that is devoted to making things better can use a poor tool and still manage to make improvements. On the other hand, a workplace that is not interested in changing can use the best tool there is around and not make any progress. So it's not the tool itself that's essential, it's the commitment to change that makes it work or not. But it's easier to use a tool that a good tool is it makes it easier. Hopefully, this peek behind the curtain with respect to gathering evidence for survey validity and reliability will help you choose the best tool that you need to improve your workplace. So thank you, and sorry I went a bit over time.
Just a little bit. Thank you. I really like your analogy of peek behind the curtains because I often think of you as the Wizard of Oz back there with the levers and all the things happening, particularly in the statistical analysis of and the present, the creation of the report from Stress Assess that shows that picture to the workplaces who participate and the participants. I didn't see any questions. We do, but I'm happy, I think, to entertain any questions in the chat, or if someone wants to put their hand up. We do have another Slido. The ministry has asked us to report to them when people learn something from our efforts. So I would appreciate you letting us know if you think that the material that we've covered today is of interest and that it could potentially make a difference in your own health and safety or that of your workplace. Or let us know if not, I guess, too. So that helps us to plan for future events. Let me just, I don't see anything in the chat. Does anyone have a question? Or John, did you have any other sort of more, I mean, it seems so complicated, and someone has asked for the slides, which we will be, of course, uploading to our website, and it'll be linked from the Mayday Mayday webpage to a place for this specific day, which will have the 3 videos and the 3 sets of slides all linked.
Well, I just want to summarize by saying that making questionnaires can seem like the easiest thing. Throw a bunch of questionnaires and circulate them and see what you get. However, there is quite a science and an art behind making a questionnaire that you can understand that measures what it's supposed to measure reliably and validly, and that unfortunately it takes that much work to do it properly. And however, that being said, as I mentioned, any workplace that wants to improve their psychosocial conditions can probably do it no matter what tool they use. It's the motivation that makes the big difference. I've seen many workplaces use our survey, which I think meets a lot of the criteria, and not make a difference. But it was quite obvious that they weren't going to respond to it in the first place. So it's an exercise in futility, even with the best evidence-based tool.
Yeah, thanks. And yeah, I think that commitment and engagement and the planning ahead of time are critical, and the anticipation that you will use the survey results to inform change, or at least to inform dialogue about the positive news and the negative news, and then that you'll do something to try and address it. I don't know, Kathy, if you wanted to make any comment about having used our Stress Assess tool. I guess you were there at IHSA all 3 times, I don't think. Maybe you were, I'm not sure. But
It's four times now.
yeah, you guys are our class tops and having been the most surveyed organization, I think, right, John? Although I could be wrong.
So
but,
there are some others too.
Yeah. Well, no, I'd say that the tool from OCAO, the stress assess, is a great tool. But to your last point there, John, it has a lot to do with the commitment of the organization, what you're going to do with that. And our last round of the survey, we spent a long time. We spent 6 months sort of assessing the results internally and going from group to group and engaging key stakeholders and even having further follow-up sessions, and then developing 32 recommendations from that, engaging that process. So it's what you do with it, and then again what you do with those recommendations. And I'm pleased to say IHSA has been taking a due diligence and working really hard on implementing as many of those recommendations as possible, you know. So yeah, I'm looking forward to the next results. Stay tuned, John.
Okay.
Great, thanks. Okay, well, we have gone over time, and I don't see any other questions aside from a thank you. And we did, I didn't have my slide open, but it does look pretty positive. So thanks to those who responded and said that they agreed that that the content would be of assistance personally or professionally. That's what we strive to do, and we're always here if people have questions, or if they about our tools, or about the presenters and about the other content. And we do have one more session this month. Next week, on the 29th, we'll host PSHSA, who will talk about their new workplace violence risk assessment in the education sector, which Kristy mentioned earlier today. So we'll hear a bit about where they've gone with that. And also they have another new risk assessment, which on harassment, I think. Sorry, I'm drawing a blank since I didn't switch my screen to reading. And then of course we have Daryl Stevenson, who's one of the OCAO ergonomists, talking about our new job demands analysis tool, which is called Job Assess, which includes psychosocial components of a job as part of assessing the demands of that job in advance from a prevention perspective, prevention of harm perspective, and also to be used for early and safe return to work, potentially, to understand what the hazards might be, the physical hazards and the psychosocial hazards might be to people returning to work, which is where pain management actually could come in. And so there's an element of that too. So I hope you can join us next week. Any final comments, Kathy or John, about today's session?
No, I just want to again say thank you, and I did drop in the chat some resources as well, and so yeah, if you haven't had a chance to grab them now. But thank you.
Great, thanks. John, anything? Did we lose him? He may have disappeared.
I think you may have.
Okay, well then, it must be lunchtime. Okay, thanks again, everybody. See some of you next week. Take care.